A very good evening to all of you. Today we are going to do the MCQ challenge of orthopedics. Why orthopedics is important? Orthopedics, about 7 to 8 questions come from orthopedics, sometimes up to 10 questions. And if it is a short subject, but still, if you master this subject, you will get all the 10 questions correct. So let's 7 to 10 questions correct. So let's begin with the first question. Identify the instrument. Four options are given. A. Elizarow's fixator. B. Rail fixator. C. K-nail. D. Proximal femoral nail. It is a fixator that's very typical of it. Now let us look at the options. What is proximal femoral nail? Proximal femoral nail anti-rotation device is a short intramedullary nail which uses a spiral blade device to obtain fixation in the femoral head rather than a conventional screw. What is K-nail? Kushner's intramedullary nail. This nail is used for fixing the fracture of shaft femur. Well, the image. What is a rail fixator? Rail fixator is a monolateral fixator available in the form of a rail or telescoping multi-joint assembly. In this, 6 millimeter pins are inserted into the bones. These pins are attached to different blocks which can move over a tract. According to need, the bone can be compressed or distracted, as in Elizarow's ring fixator. However, it is less versatile as compared to Elizarow's fixator and it cannot be used to at all in osteoporotic bone. It can be applied in compound fracture, limb lengthening, infected non-union, etc. So the correct answer here is B, rail fixator. Identify the given splint. A, dynamic finger splint. B, sugar tongue splint. C, cock-up splint. D, knuckle bender splint. Well, it is a cock-up splint. Now let us look into the details of splint. Cock-up splint is a static wrist arthrosis, can be used in wrist pain, De Quervain's disease, Colles fracture, carpal tunnel syndrome, wrist drop, and hemiplegia. Now, what is a sugar tongue splint? What is a knuckle bender splint? Knuckle bender splint simultaneously flexes the metacarpophalangeal joint of all digits without blocking the interphalangeal or wrist motion. This knuckle bender splint is used in case of ulnar nerve palsy. What is a dynamic cock-up splint? This dynamic cock-up splint extends the proximal interphalangeal, distal interphalangeal, and wrist joints passively while the patient flexes his wrist and fingers voluntarily. This is why it is called as a dynamic splint. This dynamic cock-up splint is used in radial nerve palsy and after transfer surgery. What is sugar tongue splint? Sugar tongue splint of forearm. The sugar tongue splint is commonly used to immobilize forearm fractures, particularly the distal radius fracture at the wrist, and in patients in whom it is desirable to maintain the forearm in some degree of supination or pronation. So the correct answer here is C, cock-up splint. A football player fall on outstretched hand while kicking the ball and felt pain at the wrist joint immediately. Identify the fracture from the given X-ray. Well, it is a Galeazzi fracture. What is a Galeazzi fracture? It is a fracture of lower one-third of radius. Fracture of lower one-third of radius with dislocation of distal radioulnar joint. Mechanism of injury: fall on hand, probably with a superimposed rotation force. Radius fracture in the lower third, and inferior radioulnar joint subluxates or dislocates. The clinical fracture feature is more common than Montegia. So the correct answer here is A. Galeazzi fracture. What is the use of given instrument to hold the bone and plate? B. To hold bone fragments with traction. C. To cut the bones for creating a gap in wound. It is a plate holding forceps. It is used in during open reduction internal fixation. Hold the plate in alignment while drilling and screw placement takes place. Earliest sign of compartment syndrome of leg is A. Tingling or numbness, B. Skin mottling, C. Pulselessness, D. Pain on passive stretch. Now, what is compartment syndrome? Compartment syndrome is more common in lower limb when there are high risk injuries such as fracture of elbow, forearm bone, proximal third of tibia, multiple fracture of hand or foot, crush injuries, and circumferential burn. The clinical feature is characterized by pain with passive motion of fingers and toes, pulselessness, pallor, paresthesia, poikilothermia, and paralysis. The pain is out of proportion to clinical situation is usually the first symptom. The pain on passive stretching is most sensitive sign prior to onset of ischemia. The late signs of compartment syndrome are paralysis and pulselessness. Diagnosis stretch test earliest sign of impending compartment syndrome. So the correct answer here is pain on passive stretch. What is the most common sequelae of traumatic shoulder dislocation in young adults? A. Frozen shoulder. B. Recurrent shoulder dislocation. C. Normal shoulder healing and movement. Subcapsular tendinitis. It is recurrent shoulder dislocation. In the fracture seen in X-ray below, what is the most commonly expected vascular injury? It is brachial artery. What is the eponym of fracture shown below? A. Galeazzi fracture, B. Montegia fracture, C. Smith fracture, D. Colles fracture. It is Montegia fracture. An athlete suffers a fracture as shown in the knee X-ray below. How is the fracture managed? A. Tension band wiring, B. Compression plating, C. Internal fixation, K. Wire fixation. It is tension band wiring. Which part of second metatarsal is shown in the March fracture? A. Head, B. Neck, C. Shaft, D. Base. It is neck. Which of the following is incorrect about PCL? A. It is the main restraint in posterior drawer test. It is an extrasynovial structure. It is the main restraint to internal rotation. It is the main restraint to internal rotation. About giant cell tumor, all are true except A. Commonly present in 20 to 40 years age group. Matrix consists of proliferating mononuclear cells. Osteoclast giant cells constitute the proliferative component. It is a benign tumor which may have none. So correct answer is osteoclast giant cell constitute the proliferative component of tumor. What is the diagnosis? Well, it is giant cell tumor. Identify the deformity: swan neck deformity, Buchner deformity, jersey finger, mallet finger. It is swan neck deformity. Glucosamine supplementation is given in A. Arthritis, B. Diabetes, C. Cataract, D. Asthma. It is arthritis. Patellar clunk syndrome is present at the superior pole of patella and impinging on A. B. Femoral component during extension. Patellar clunk syndrome. Patient complains of clunking during knee flexion caused by suprapatellar fibrous nodule that interferes with patellar movement. Many patients can be managed without surgery. However, if there is persistent symptoms, surgical excision of nodule can be useful. Irritation of lateral facet of placenta, contact between the lateral facet of placenta and femoral implant. Please click the link in the description to join the 3-day Ultimate Neet PG Breakthrough Blueprint. It is useful for those who are revising for Neet PG 25 and those who are preparing for Neet PG 2026 and even then those who are preparing for National Exit Test 2028. It will be a highly beneficial class for you. The first 10 people who click the link will get free entry into the masterclass. It is a live online class. More specific for diagnosing ankylosing spondylitis is HLA-B27B bilateral spondylitis C lumbar movement DSR. It is bilateral sacroiliitis. What is the most likely cause of abnormality seen in wrist X-ray of the child? A. Scaphoid fracture, B. Colles fracture, C. Osteoporosis, D. Rickets. It is rickets. What is the clinical picture of ricket? Generalized muscular hypotonia of unknown mechanism is observed in patients with clinical signs of rickets. Craniotapes, that is areas of thinning and softening of bones of skull, manifest early in infant with vitamin D deficiency. Although this feature may not be present in infant, especially those born prematurely. If rickets occurs at later age, thickening of skull develops. So correct answer is D. Rickets. A 75-year-old female had a fall and an intertrochanter fracture. This is due to A. Osteoporosis, B. Osteopetrosis, C. Paget's disease, D. Metastasis. It is A. Osteoporosis. A 55-year-old male presents with severe backache for 10 days and urinary incontinence with history of intervertebral lumbar disc prolapse. There is no history of fever or weight loss. What is the likely diagnosis? It is cauda All of the following are true about Sprengel's shoulder. He associated with diast, except usually associated with dextrocardia. Now, what is Sprengel's deformity? It is elevation of scapula. It is the most common congenital shoulder abnormality. Sprengel's deformity is usually noticed at birth. Asymmetry of shoulders with elevation and underdevelopment of affected side. Scapula is abnormally small and too high, associated with hypoplasia and atrophy of regional muscles. Elevated scapula is visually noticeable with restriction in motion of scapula and glenohumeral joint. Occasionally, both sides are involved. The associations of Sprengel's deformity are Klippel-Feil syndrome, spina bifida diastematomyelia, kyphosis or scoliosis, torticollis, underdevelopment of clavicle or humerus. Treatment is required only if shoulder movements are severely limited or if the deformity is particularly unsightly. So the correct answer here is C, usually associated dextrocardia. What is the likely diagnosis of image shown below? Coxa vagna, coxa valga, coxa vara, coxa sultans. It is coxa vara. A neck shaft angle of less than 125 degree is referred to as coxa vara. Because where the neck normally aligned relative to pelvis, the limb would be deviated towards the midline of body in varus. A neck shaft angle greater than 125 degree is coxa valga. Myalgia paresthetica is due to involvement of lateral cutaneous nerve of the thigh. Identify the deformity given in the picture: hallux valgus, hallux varus, cubitus valgus, rheumatoid nodular. It is hallux valgus. Haglund deformity is seen in which joint? A. Elbow, B. Knee, C. Wrist, D. Ankle. It is seen in ankle. Bony enlargement formed at posterior superior aspect of calcaneum.